Hello everyone, this is myself Kavya Shettigar. I'm an assistant professor working in a unit of respiratory therapy in Yenepoya School of Allied Health Sciences. So today my topic is regarding to assessment of dyspnea. So we all know that dyspnea is one of the main common symptoms which we mainly see in all the respiratory diseases. At the end of the session, you will be able to learn describing the major physiological mechanism that is causing breathlessness in respiratory diseases, and also you will be able to use the MMRC dyspnea scale and patient history to assess and categorize the severity and possible causes of dyspnea, and also to differentiate between various clinical presentation of acute and chronic dyspnea based on underlying respiratory and non-respiratory causes. So we'll be focusing on the contents, basically introduction, mechanism of dyspnea, assessment of dyspnea, causes of dyspnea, and diagnostic approach to dyspnea. So coming to the basic idea about what is dyspnea is mainly, so when we talk about the dyspnea, we mainly has to focus, there are two words where it can say that what is dyspnea. So either we call it as a breathlessness or else we can call it as a shortness of breath. It is one and the same. So when we talk about the dyspnea, it is mainly tell you the feeling of how uncomfortable you are trying to feel when you start taking a breath. That is the major concept what is we are trying to deal with dyspnea. So mainly when we are trying to talk about a dyspnea, you should be aware of this dyspnea is mainly caused because of different diseases which is mainly categorized under respiratory and cardiac dysfunction. So any of the diseases mainly you see as one of the key common specific respiratory symptom as dyspnea. So it is very challenging as we have to know how to quantify it and all the diseases which will be ending up into dyspnea or a breathlessness. So to identify this dyspnea as a challenge, as we face a challenge, it will be very important to know how to assess the dyspnea. So coming to the mechanism of dyspnea, so before going to how to assess the dyspnea, you should be aware of what is the physiological behind dyspnea. So when we try to talk about the dyspnea, there are three mechanisms behind dyspnea. That is, first one is stimulation of afferent nerves. So what do you mainly talk about stimulating the afferent nerves? So it is basically inflammatory mediators which is mainly we are trying to see in interstitial lung disease, which also trying to irritate the sensory receptors in the lung parenchyma. And not only that, even embolic obstruction which we mainly see in pulmonary embolus, which will try to irritate your sensory receptor that is present in the lung parenchyma. So this both interstitial lung disease and the pulmonary embolism which will mainly trying to affect irritate the sensory receptors, and further you will see the stimulation of C fibers and J receptors which are mainly present in the alveolar walls. So once this is being stimulated, these fibers are being stimulated or the J receptors are being stimulated, the impulses which is generated in the afferent nerves will be transmitted to the respiratory centers which is mainly present in the brainstem and the cortex, that is cerebral cortex. So that's where you will see the perception of dyspnea. So that is the first mechanism of action of dyspnea what you are trying to see with the physiological aspect. There is a second mechanism of action where you see with the dyspnea, that is mechanical load in respiratory muscles. So when we talk about the mechanical load in respiratory muscle, there are two disorders which we mainly comes to plays a major role. One is obstructive disease and other one is a restrictive disease. So when we mainly talk about the obstructive disease, you will see increase in the airway resistance. So we know that when there is an increase in airway resistance, you will see the airflow limitation. Not only that, when you see in a restrictive disorders, you will see reduced lung compliance. So reducing the lung compliance, which will makes the increase in a elastic load. So when you see all this increased airway resistance and decreased lung compliance is further trying to increase the work of breathing. So your muscles, respiratory muscles will experience more of workload, which will ultimately end up into fatigue, and there will be no proper contraction of a muscles. So this feedback which is mainly formed by the muscle spindle or mechanoreceptors, that is especially that is present in the chest wall of the lung parenchyma, you will try to see the increased effort that is sent to the brain by the sensory feedback which is generated. So further, that's where it will end up into perception of dyspnea. So third mechanism related to the dyspnea, which we are trying to talk about, the V by Q mismatch and hypoxia. So when we mainly talk about a V by Q mismatch, we already know what is V by Q, that is ventilation and perfusion. So some areas of the lung will receive more ventilation or more oxygenation, or some areas of the lung will not get adequate blood flow. In that case, you will see V by Q mismatch. Similarly, there might be a vice versa, which is nothing but there might be more of ventilation and less of blood flow, or less of ventilation or more of blood flow. So both the cases there will be chances of having decreased level of oxygenation in the blood, so which is finally leading to hypoxemia. So during this case, whatever the chemoreceptors that is present in the carotid bodies, this will try to detect the low partial pressure of oxygen. That's where you will try to stimulate the respiratory centers, especially that is present in the brain, which will further increases the respiratory drive. So that's where you will see the perception of dyspnea. So in all these three cases, it could be stimulating the afferent nerves and increase in the mechanical load of respiratory muscles, and the V by Q mismatch and hypoxia. All these three will end up into dyspnea. So these are related to the physiological mechanism. So coming to the actual concept of assessment of dyspnea, which I have already mentioned in the objective, using of MMRC dyspnea scale, which will help you to understand about what is the severity of dyspnea level. So this is basically mainly based on the grading or severity based scoring what is being done for dyspnea if a patient is trying to show this uncomfortable feeling of breathlessness. So there are almost 5 severity of grading, that is starting with the MMRC grade 0, 1, 2 and 3 and 4. So this is mainly where grade 0 will be focusing on where the person is doing some kind of a strenuous exercise where the patient might feel breathlessness, or grade 1 will be mainly talking about when a person is walking on the slight hill, patient might feel I'm having a shortness of breath, where the grade 2 where the person who is having with the same age, the other person can have no breathlessness, but the one who is already having that severity of breathlessness, they might end up while walking breathlessness. Grade 3 is where the person, if they walk for only 100 meters, they might feel like I'm having a breathlessness. So the last one, grade 4, even if the person is having or doing any kind of a normal daily living activities, it could be of dressing themselves or taking a bath or any kind of things, the patient might feel breathlessness. So these are the 0 to 4 is the severity grading what is being done to assess the dyspnea in a patient. After all doing this dyspnea assessment, there are also some causes behind dyspnea, that is nothing but we say about the triggering or triggers of breathlessness or triggers of dyspnea. So when we go for causes of dyspnea, you should be focused on specific question need to be asked to identify the triggers of breathlessness or triggers of dyspnea, because there could be so many reasons for developing or to have a patient with breathlessness. So these are the specific question can be asked to rule out what exactly made the patient to have a breathlessness. So the first question we can ask, like, how did the breathlessness come on? Because breathlessness might come because of a patient who had sudden onset of symptom, or it could be within hours or within a days patient might have a breathlessness, or patient might have an insidious onset of breathlessness. So in that all the cases patient might end up into breathlessness. So you have to understand what is the level of onset, whether it is sudden, insidious, or within hours or days patient is developing this dyspnea. That's where you will get to know by asking this particular question, how did the breathlessness come on? So the next question you can ask, like, when does the breathlessness come on? That is nothing but whether the person while doing a exercise patient had a breathlessness, or whenever the patient is walking the patient had a breathlessness, or what. That is what we can try to know by asking this particular question. And then two questions you can ask simultaneously, asking like, tell me something you do that would make you breathless, or how far can you walk on a good day. So this question will be answerable by the MMRC scale, what we have already discussed in the previous slide, which will make sure to understand more about to the level of severity what is being seen with the dyspnea level, or to quantify the dyspnea. These two questions will help in understanding more better way. And some other questions like, is your breathing normal some days? This question is mainly helpful in asthmatic patient, because asthma will occur in a patient when there is a variation in the season, or variation in the morning and the night. Due to the variation in the day, you will see the symptoms will be worsened or it will be better. So this will help in asking whether all the days whether the patient is normal, or some days only the patient will feel a breathlessness. So that answers can be answered by this particular question. So how is your breathing at rest and overnight? So this will help in understanding, because when we talk about asthma and COPD, asthma is mainly caused, or if a person is having asthma, patient while he is sleeping in the night, he will mainly feel breathlessness, because we already know that due to the position changes there is a chances of having a breathlessness, especially with orthopnea and all. Similarly, when it comes to COPD, the patient will have a breathlessness, but patient when they have some kind of exertional, only the patient will have a breathlessness in the overnight. But it is not like asthma patient. Asthma patient will have in the night time also the breathlessness will be there, because patient will have positional changes, due to which you will see a more of dyspnea levels. So that these all are the questions which will identify the causes of dyspnea. So this sixth question will help you to understand the triggering factor of dyspnea. So far we have discussed on the physiological mechanism of dyspnea. So now this slide, which will mainly talks about the psychological aspect of dyspnea. So mainly we see the person who will mainly say that I feel that I can't get enough air into my chest. This is the psychological aspect of dyspnea, what the person is trying to feel. So in this case, what is mainly going to happen is, when the patient is having hyperventilation, where the patient is trying to exhale the carbon dioxide more oftenly due to anxiety or due to of any kind of fear, patient will end up into dyspnea. But during this time their vital capacity will be normal. But along with this anxiety, when the patient is having this kind of breathlessness, they will develop some other symptoms also, is like digital and perioral paresthesia can be seen, which is nothing but tingling sensation or a numbness all over your around the mouth and in the fingers or the toes can be seen. Along with that, patient might have a lightheadedness and sometimes patient might end up into chest tightness. So all this also related with dyspnea, where we are not just focusing on psychological aspect of dyspnea, also we are focusing on physical mechanism of dyspnea. So in this session we have discussed two of the aspect of dyspnea. One is physical mechanism and the psychological mechanism. So coming to a summary of this diagnostic approach to dyspnea. So this flow chart will mainly explains about what could be the duration, what could be the time course and what could be the history and what are the different examination can be done to rule out the particular disease which is mainly causing the person to have dyspnea or a breathlessness. So if you see with the first aspect, how the person is getting a breathlessness, it can be based on acute or chronic. So if it is acute, as I already mentioned in the few slides back with the specific question, we can ask whether the person is having sudden onset of dyspnea or within the hours or days whether the person is getting a dyspnea or whether it is insidious dyspnea. So in that case, there are particular history you have to ask to the patient, whether the patient is having pleuritic pain or crushing central pain, or it could be of whether the person is having a fever, cough, or whether the person is having a green sputum, tightness, atopy, or the pet's fur. Is there any kind of such kind of history, or the patient is having any kind of weight loss or cough or dry cough? These questions can be asked. Similarly, based on that, if you have a proper investigation to that particular history what is being collected, you will know what is the actual diagnosis of patient is having a breathlessness. Similarly, for chronic cases, we can ask whether the patient is having the time course of getting a dyspnea, whether over a night or when the person is taking a rest or due to some kind of any kind of allergic triggers or exertional of any type of triggers which makes the patient to have a dyspnea. So based on that also you can take a proper history. If you have a proper history, based on that you can do a further investigation like auscultating a patient or doing some kind of percussion to a patient, so which will identify what is the actual cause behind dyspnea. So this will tell you the more detailed matter or detailed manner of how to decide on the disease diagnosis of breathlessness. So overall, this gives you a summary of breathlessness to identify what is the cause behind dyspnea and what could be the diagnosis in particular patient who is ending up into breathlessness. So to summarize this entire session, I can just explain, as I said before, this is a dyspnea where we mainly see the person who will have a feeling of I'm not getting enough air. That is what will be the first aspect of dyspnea. At the same time, we can see this dyspnea symptoms in many of the respiratory and cardiac conditions. It is not only meant for respiratory problem. And also there are three mechanisms behind dyspnea. They are nothing but one is stimulation of afferent nerves and increasing the mechanical load, and also there is a chance of hypoxia which will end up into dyspnea. And not only the physical aspect, there is also psychological factors which will affect a patient who is ending up into dyspnea. And other than that, there are MMRC dyspnea scale to rule out what is exactly the patient is having. Based on the severity grade, you can quantify dyspnea based on MMRC dyspnea scale, and also you can take a patient's history to identify what could be the onset, what could be the pattern of having this breathlessness, and what could be the triggering factor to ending up into a particular diseases which is correlated with particular symptoms. So this all will help in identifying, assessing or guiding tool to assess the dyspnea. So thank you all.